Good morning and welcome to the podcast. My guest today is Kate Siefert from I got to look, make sure I got the right title, the Crawford County Health Department.
Yes.
Did you get that right?
Well, technically we're Crawford County Public Health, but I go by
Okay.
anything, so it's okay.
Crawford
it's okay
County Public Health.
Yes.
All right. I stand corrected.
Thank you for having me today.
Thank you for coming. A lot of news, a lot of exciting things going on, a lot of new things. I see where on our last podcast we talked about the vending machine, what do they call it, the harm reduction?
Harm reduction vending machines.
Okay,
yeah.
those now are a reality.
They are now a reality, yeah. Thanks to an amazing collaboration with Avita Health System, they agreed to host the sites. So there's one at each of the ER entrances, one in Bucyrus, one in Galleon, and then we have a grant to supply the materials that go inside the vending machine. So we're able to put out free COVID test kits, which are extremely popular. I didn't think they would be, but I'm often wrong, so I shouldn't be surprised. And then...
Well, you're not the only one that's wrong, man. I'm usually wrong as well.
Oh, okay. But yeah, the COVID test kits have really been flying off the shelves, literally. So we're happy to put those back out there, and we're glad people are putting to use, because they really don't do any good sitting in our storage area. We've got fentanyl test strips in there. We have male and female condoms. And then we also have 2 different types of naloxone, Narcan, that people can take too. And everything is free. You just go up to the vending machine and push the button for which item you want, and it drops down, and you can help yourself. So
Where
they're
are these
available.
located?
They're right outside the entrances to the ERs.
Okay.
They're in well-lit areas, easy access, right off the parking areas, so that it's easy for people, and they can go 24/7 and get what they need.
Now you're
and put to
talking
use.
which hospitals?
Both.
Both?
Both of the Avita ones in our county. So there's one outside
Galleon
of
and Bucyrus. That's the point I want to get at, because these podcasts go out everywhere.
Yeah. So we're really happy that they were able to find a spot and host 2 of them. And both have been popular. We've been tracking the materials that we've been putting in each of them and how much we're going through. And surprisingly, they're both being heavily utilized. So we are struggling with the keeping up, and I apologize to those that get up to the vending machine and it's empty. We're trying our best. We're actually seeking volunteers to help us do the stocking of the vending machine. So if anyone's interested in helping us with that, they can reach out to our office, and we would be grateful.
Well, it's hard sometimes to assess what the demand is until you're actually in the line of fire of what's going on. So this is understandable.
And the grant was for supplies, not for manpower.
Oh, there you go.
So, it's not like we could bring in additional people or shift duties and things like that. We still have our tasks that we normally do, plus this. So we're trying, we're doing our best, and we're happy though that they're being utilized, because we didn't want to go through the effort and not have them being utilized. So, and they're just one more tool. So I keep reminding people, all these things are it's just one tool. This is not the answer to, say, having the Narcan out there, the fentanyl test strips. This is not the answer to the drug epidemic that we're dealing with. It's just one more tool. And I keep thinking, I need to find every tool that I can that public health can, and put them all out there. We already have our sheriff and our law enforcement and our prosecutor's office and our judge doing an amazing job every day dealing with the drug epidemic. And so the rest of us need to do our part too. So we can't expect them to fix it, because that's certainly not their job to fix it. It's everyone's job to jump in and do their part. And so if public health can put out some harm reduction materials to help keep people alive, and that's the whole point with harm reduction, is to lower risk of infection of diseases and keep people alive, to get them to the point, keep them alive so they can go into recovery and into treatment. And that's our goal. So it's just one tool. It doesn't, it takes all those things. You also need the treatment. You need the support for recovery. And there's a whole bunch of tools required to face the drug epidemic. But what we can't do is not put all the tools out there and expect law enforcement and the judge and the prosecutor to take care of it for us, because they just can't.
No, it's pretty.
They're amazing, but that's not their role. Yeah.
That's good. Now I want to segue into something, because you brought up about in the vending machine about the COVID test. Where are we at now, Rye, with how's the COVID situation? Current assessment. There's 2 things: COVID and this respiratory deal that's going on now.
Yes.
There's a lot of people that's got this respiratory.
There's
I
a lot of
am rattling
respiratory. It
all
is
over.
that time of the year
Okay, good.
when we see an increase in respiratory viruses. You know,
Okay.
we've moved indoors.
Sure.
So we're around each other more often, and we've hit the holiday season, so we're intermingling more. So our bubbles are slightly different. We're crossing our bubbles. You know, you don't have your normal people that you're always around every day. You're intermingling with other bubbles, so to speak. We used to talk about that in COVID world, to stay in your bubble. But you know, you're around your family members that you might not see all the time, your friends that you might not see all the time. So your exposure is different. So yes, you're going to be exposed to more this time of the year, so it's natural to see a spike. We are seeing an increase in COVID cases. There is even some hospitalizations. Now, we are not where we were when COVID first came out. So we are fortunate that as it goes through its cycle and its variations, and we are getting a stronger immunity to it, that we are not seeing the multitude of extreme cases like we were seeing. Yes, people are still getting sick. Yes, some people with complications and other health issues, it's a stronger battle for them. But so would the flu, so would the cold and all that. So it's a fine line to walk where I don't want people fearful and not leaving their homes and not enjoying the holidays. I just want them to be aware and be a little bit cautious to remember, wash your hands a lot. Cover your coughs and sneezes, all those basics. If you have a fever, if you are coughing horribly, if you are not feeling well, please stay home. I don't care if it is just a cold. I don't want it. Nobody wants it. If it's just a strep throat, sore throat, it's not COVID. And that's what people say to me. Well, it's not COVID, so I'm going to go anyways. And I'm thinking, well, even if it's strep throat, I don't want that. So I just want to remind people just to be aware. And the COVID test kits will help you make that decision because it's a different level of decision making. If it does test positive for COVID, you are contagious for a little bit longer than some of our other viruses. There are some people that you might interact with that are more susceptible, so it can help you make that decision. So maybe you shouldn't visit your aunt in the nursing home if you test positive for COVID. Please keep that in mind.
Yeah.
And that's a basic. You can make that decision yourself. You do not need to have, it's nothing political, it is nothing economical, it is just a basic, it's a virus, highly contagious. That hasn't changed. The severity has changed, but for some people, unfortunately, though, they're still very susceptible. So
Well,
it's just decision making, and that's what we put these tools out there for. It's decision making purposes, and we want to help you with your decisions.
I guess the point I'm getting at with this, the reason I brought these two topics up of the respiratory and the COVID is you just want people to be aware. You don't want people to get paranoid.
Right.
You just want them to be aware.
Right.
And if you're aware of what's going on and you think that, then you can
Make good decisions.
make your decision
Yeah.
what you want to do in there.
Right.
I'm going to segue into something else, totally different.
Okay.
Veggies.
Oh, yes, eat your veggies. No, we are fortunate right now that the state WIC office put out a notice to all the counties to.
Now, by the way, we better just explain what WIC is because some
Oh,
people
yeah,
might
right.
not
I'm
know
sorry.
these
I'm
issues.
sorry. So, women, infant, children.
Okay.
We serve prenatal up to age 5, typically income eligible, and then it can be. It doesn't have to be like your biological children. You can be foster care, kinship care. We see an all range. We do also serve a lot of working families where they're both working, but they still qualify for WIC, which is amazing because that brings in a nutrition supplement for you and helps save you a little bit at the grocery store because we're all hurting at the grocery store right now on some of your food. So, you know, I always keep reminding people just because you're both employed, it does not mean you won't qualify for WIC. And if you think you might, just call our office and we'll figure it out for you and help
Well,
you.
if in doubt, find out
That's
because
right.
the bar for such switches all the time. As I always
It
say, the
does.
qualification to receive women, infant, and children's
Yeah.
assistance.
And right now, our WIC participants, we want them to come in if they haven't already for their upcoming months. The state WIC office has let us know they've expanded and increased their vouchers for their fruits and veggies. So, which is awesome for the winter months.
All right, now we've covered vending machines. We've
Yep.
covered Viruses,
Yeah.
both with V's, and vegetables. All three were V's.
Well, then let's go to vaccination and keep the V's going,
All
shall
right,
we?
let's go on.
Just always your friendly reminder from your health commissioner,
there you
stay
go.
current with your vaccination. So I wish I could tell you to come to our office for your COVID vaccine, but unfortunately we could not get the COVID vaccine. We did put in a hold for some Moderna. We're still hoping, but when we talked to Moderna a few weeks ago, they were like 20,000 customers behind, and we're customers some 10,000 something behind. So we're in the queue,
Yes.
but we have no idea when it'll be coming to us. So I still want people to get their COVID vaccine if they want it. All of our local pharmacies, a lot of them are having it, so you can go there. It does not matter if you had Moderna before and now you get Pfizer. If you had Pfizer before and now you get Moderna, it's okay. You can mix and match. Take your card, they'll update it for you, and so there's still those options. So well, you can't come on to us for your COVID shot. We'd still love to see you for your shingles and your chickenpox and your tetanus and all those others. So I want to remind people still keep current on those. It's important, and we would love to see you.
What you're saying is, as far as getting those vaccinations, it's in the pipeline at this point.
Yeah.
You could potentially
With the
get them.
COVID vaccine.
Yes,
Yeah.
yes.
So I wish I had better answers for people
Yeah.
because I probably get that question, not quite daily, but definitely weekly. And I wish
Well,
I had a better answer.
You can only answer the question for what you know,
Mm-hmm.
and I say it's on a need-to-know basis, and they didn't bother to.
Yeah.
They didn't bother to let you know, so
Yeah.
you didn't need to know at this point. I'm being a joke about it, but it's not really funny. But I'm just
Yeah.
saying that
Yeah.
sometimes the last to know is the person who has to be asked to administer it. Let's just put it that way.
That is true. I am sometimes the last to know, and it's okay because I've got great people on staff making great decisions, so I don't have to worry about that. But it's like, ooh, I'm so excited to learn that. I didn't know.
Well, we went through all of the V's. Are there anything else we need to get into today, Kate?
Well, I do like to remind people when we go into the holidays and we're doing our family gatherings that food safety is still important
Oh,
at
yes.
home, not just at the restaurant. So when you're getting your family together and you've had that great meal, please don't leave it sitting on the counter for 6 hours and then nibble on it some more. When you're done eating, it's time to get up and put it away and put it back in the fridge. And when we go to reheat, we like to remind people to reheat to 165 so that, we don't have to worry about that. Because,
Folks, get a food thermometer.
yeah, and just, keep that in mind that foodborne illness does not just happen at the restaurants. And actually, the last several cases that we've had to deal with, it's been family potlucks.
Yeah.
And then the next day, people start spending all their time in the bathroom. And we'll do our investigation and find out it was a dish they all shared
Yeah.
at
That's
the
kind
family dinner.
You'll see, like you said, and that is something that is not to be toyed with because
No.
some of these can be extremely serious.
They can be. I know some people kind of like, oh, it's just foodborne illness, but unfortunately, it can lead to dehydration. And then for people that rely on medications they take daily, if you can't keep your medication down and you become dehydrated, you end up hospitalized.
That's a bad combo.
And honestly, with all the viruses out there going around and people being hospitalized, you don't want to join them in the hospital.
No.
So if you don't need to be there, so you can avoid that. So it is important, that food safety at home. We don't want to have to have lots of phone calls with all your family members and figure out who it was. And, I remind people too, if you are not feeling well, if you are running to the bathroom more frequently than often, please do not prepare food for others. I don't care how good you wash your hands. Please be considerate, and don't be making potato salad for 30 if you are going to the bathroom every hour. So.
Well, I know people already. You mentioned that with potato salad, and I'm not picking on potato salad.
Yeah, I don't mean to pick on potato salad either. It's just
but-
a common,
But I'm just saying things with mayonnaise in them sometimes. If
Yeah.
mayonnaise is not handled properly and correctly, can be very nasty.
Well, it's not the actual mayonnaise itself, because actually mayonnaise could sit out. If you had a jar of mayonnaise It could sit out. You don't have
Okay.
to refrigerate it. People have that misconception.
Okay.
Now it's going to get disgusting on you.
Yeah.
It's going to separate, and it's not going to look very pretty. But safety-wise, the pH of mayonnaise, it won't grow bacteria, so it's okay. However, once you mix mayonnaise with other ingredients, you've changed the pH of it, and that is where the issue comes into.
Oh, that's where it is.
So we shouldn't pick on mayonnaise itself.
No. It's what you add to the mayonnaise
It gets a bad rap.
So what
Yeah.
you're saying is it's what you add to the mayonnaise that can add
It
to the
changes
adventure.
the consistency. So then you've introduced other things, and you could potentially have the bacteria from, the chopped celery or the other ingredients, the eggs if they weren't properly cooked, the hard-boiled eggs
Okay,
and all
yeah,
that.
that makes sense.
So I know condiments sometimes get a bad rap, and if you go to a restaurant, because we'll get called, like, oh, their mustard and their ketchup were sitting on the table all the time. They never put them away. It's like, it's okay. You might change the quality, but you're not changing the safety of the condiments. Same
That's
with
very
a lot
interesting.
of salad dressings can sit out as well. And you'll see on the side, if you read the label, it's not that it must be refrigerated. It's, for quality purposes, refrigerate after opening.
Yeah.
And that's why, because things will separate and not be as appealing.
See,
So.
this is why we have you on here, so we can be educated.
Yeah.
Because I needed educated.
Sometimes those labels are confusing. There's a best buy, not a must-use buy.
Yeah.
Yeah, and it's a
Not
quality.
you
It's a
should
quality.
you should throw this out.
Yes.
Label, but we sometimes should be better just to throw it out.
Yes. Yeah. So, and I try to, I live with 2 teenagers, and I try to remind them is they want to throw that milk out right away because it was, expired yesterday. I'm like, but it's fine. It really is. It's fine. I trust me. Your mother is not going to give you bad milk.
She's from the health department.
Yeah. Same with eggs. A lot of times, it's a best buy on the eggs, and they're actually, if you store them properly all that time, you can extend it a little.
Well, I'll tell you, I think we've given people more information than they probably even wanted to
Yeah,
have
I
here
know.
today.
And we would love to hear from them. So if they ever have questions about anything, if you have
How do they get a hold of
concerns,
you?
they can give us a call, 419-562-5871. They can
Social media?
stop out to see us.
Okay.
We're located at 1520 Isaac Beale Road on the south side of Bucyrus, which most people know us as the former Baja building. We love keeping that association. So we love it when people come in and like, oh, my uncle used to work here. Oh,
Yeah,
it looks so
yeah.
different. And that's okay. We'll give them a tour. No problem. And then they can follow us on Facebook, Crawford County Public Health.
All right.
Yeah. Well, it's good to see you.
All right. Did we exhaust all of our possibilities here today?
Oh,
At
I could
least for
talk.
this-
You know what? I could talk forever about the
Yeah.
amazing things my coworkers do at the health department, but that wouldn't be fair to you.
Well, you want to keep your audience
In suspense.
so that you're
More to
welcome
come.
for it.
More to come.
More to
There's
come.
always more to come with the health
There you
department.
go.
So
I want to
Well.
thank Kate Siefert from Crawford County Health,
public health.
Public Health.
You'll get it someday.
these days
Just
I'll
keep
get it.
having me back. You'll get it. It's okay. I love coming back.
I like
so.
to say Crawford County Health Department. But,
It's easier, and you know what? I don't cringe about that either. So
all right.
it's
So,
all right.
yeah, either way, you'll be a guest, right?
As long as you think of me when you need something public health related, I'm happy.
Wonderful.
Okay.
Thanks, Kate, for being a guest.
Thank you.